Ontario is in a healthcare crisis, perhaps the worst crisis in the province's history. Every day, thousands of patients wait in hallways to be seen by doctors, patients wait years for medical procedures, and hospitals across the province are being forced to close emergency departments and surgical clinics due to lack of funding. The worst part is that all of this is by design. Since Doug Ford came to office, his government has systematically dismantled public healthcare in Ontario, forcing Ontarians to rely on the private sector, which puts profits over people. One of Doug Ford's first promises was to end hallway medicine in Ontario, leading up to being elected premier in 2018. But the results have been exactly the opposite. Just about every possible metric for healthcare efficacy in the province has gotten significantly worse since 2018. The number of patients getting hallway medicine, basically being given basic treatment on a stretcher in a hallway because of a lack of beds, has more than doubled to around 2,000 people. The number of Ontarians without a family doctor has increased by over 1 million to 2.4 million. Emergency room wait times have increased by 67%. And unplanned closures of hospitals' emergency departments, ICUs, birthing units, or urgent care centers, what was once nearly unheard of, have hit historic levels. In 2023, nearly 1,200 of these departments closed, primarily due to staffing shortages. Ontario says it's pouring billions into healthcare, and that's technically true. Healthcare funding is increasing year over year. But particularly in recent years, those increases don't keep up with the cost of inflation or take into account an aging population, meaning Ontario's healthcare budget isn't even adequate to maintain the status quo. Every year, more and more healthcare professionals are being laid off, and hospitals are increasingly unable to perform previously standard procedures. The Ford government says they have the solution: privatization. In 2023, they passed Bill 60, or the Your Healthcare Act, which significantly relaxes the regulations around for-profit clinics and hospitals in the province. The private sector, they say, will reduce wait times and increase capacity. The truth is exactly the opposite. There's two main types of healthcare privatization. One is the American-style system, which is still technically illegal in Ontario. This system has individuals or their private insurance companies paying out of pocket for necessary procedures. The second is what is primarily happening in Ontario. Under this system, all necessary procedures are still covered by the province. They're simply delivered by for-profit companies. Now let me ask you a simple question. If your tax dollars are paying for healthcare, which clinic would be cheaper? The public clinic or the for-profit clinic? If you answered the public clinic, you're right. This is the most staggeringly obvious problem with for-profit healthcare. Public healthcare is policy forward, meaning all the government needs to pay for is the costs of delivering healthcare. For-profit healthcare is profit forward, meaning the government is paying for the costs of delivering healthcare plus however much profit the private company deems appropriate. Which is why Ontario taxpayers are paying significantly more for these for-profit clinics to deliver the exact same services as hospitals. Let's look at an example. The Don Mills Surgical Centre, which we will talk about more in a moment, offers a number of surgeries including cataracts and knee arthroscopies. In a public hospital, these procedures cost the taxpayer $508 and $1,692 respectively. At Don Mills, they cost $1,264 and $4,037 respectively, well more than double for exactly the same procedure. Beyond the costs of procedures, privatization has allowed companies to find ways to charge the government for completely unnecessary services in order to maximize their profits. The Ford government has given contracts to Shoppers Drug Mart, owned by everyone's favorite company Loblaws, to operate private primary care clinics. Shoppers, of course, also owns pharmacies, which creates an immediate conflict of interest. Shoppers' clinics have an incentive to prescribe medicine, whether needed or not, because those prescriptions can be filled at Shoppers' pharmacies, creating a profit loop. And Shoppers has been finding other ways to make money from OHIP. Shoppers has been charging the Ford government for unnecessary med checks, which are free consultations between a patient and pharmacist, where the pharmacist explains how to properly use medication. Shoppers set targets for med checks, leading pharmacists to cold call clients, Each of these cold calls netted shoppers $75, which is $37 more than a doctor's visit for a medication check would cost, and $75 more than if the med check was done with the pharmacist when the patient picked up their medication. In 2023, med checks alone cost the provincial government $60 million. So private companies are using your tax dollars inefficiently, and also charging the provincial government for services that never needed to be completed in the first place. But beyond that, they may also charge you hundreds or thousands of dollars for procedures that should be covered. Private clinics have made it a habit to prey on the elderly specifically by lying to them about wait times and charges related to cataract surgeries. Although it's illegal for private clinics to charge patients out of pocket for necessary procedures, that hasn't stopped them from slapping on unneeded tests or additional charges, hoping a patient is not aware of what should and shouldn't be covered. Ironically, in recent years, Ontario actually had some of the best wait times in the country for many surgical procedures. In the case of cataract surgery, the average wait time is only about 100 days. Yet these private clinics give patients the impression that these wait times could be years. For just around $7,000 or $8,000, they can get you in just 2 weeks. This behavior is illegal and predatory, and the Ford government has repeatedly refused to do anything about it. Patients are using their savings, taking out loans, are going back to work in their 70s to pay for a procedure that should be free. Exploiting and preying on a patient's vulnerability is a unique characteristic of private for-profit healthcare. Private clinics are also not a solution to gaps in public healthcare, because research shows that private clinics only make those gaps worse. Since private healthcare is more expensive, there's even less funding available for the public sector. Private clinics and staffing agencies recruit nurses and doctors, removing them from public hospitals. Those public hospitals then have to rely on private staffing agencies to fill gaps in personnel, which can charge well more than double what a healthcare staffer normally costs. Once again, if we look at this logically, it makes absolutely no sense. Ontario has been forced to either limit hours or entirely close thousands of departments across public hospitals because they don't have the funding to staff them. Yet instead of increasing public healthcare funding to staff the hospitals that already exist, Ontario is paying private companies millions to build new clinics, which then cost far more to staff and deliver services, while they pitch that as a solution. That is utter nonsense. But surely if the costs are so much higher, the care must be better too. Unfortunately, no. A recent study of high-income countries like Canada found that the shift from public to private care in a hospital setting led to worse quality of care and health outcomes, including higher rates of infection and more preventable deaths, not to mention worse rates of access and equity. A private company, Grifols, which operates across Canada, is a for-profit company that collects plasma. 2 people have died after having their plasma harvested at a Grifols clinic, and another man is suing the company because of kidney damage. Grifols has been found to be non-compliant at least 5 times for serious infractions, including inadequate screening of donors, ensuring plasma is not taken too frequently, cleaning and maintaining equipment, reporting, following proper processes for accidents and errors, and training of staff. International evidence shows that private for-profit healthcare is generally less safe and provides lower quality care, which makes sense. Profit-motivated clinics find ways to cut costs and maximize profits, hiring fewer staff and cutting corners. Quite simply, the research shows that an increase in for-profit hospitals and clinics means that you pay more and your chance of dying increases. So if private medicine is more expensive and worse, why is it receiving increasingly more funding every year while the public sector gets less? We're talking about Doug Ford here, so let's follow the money. Unsurprisingly, private clinic owners who have benefited from Ontario's privatization push have donated tens of thousands of dollars to the Ontario PCs, largely over the last few years. The Herzig Eye Institute received a license to perform 5,000 cataract surgeries per year. Days later, they donated $2,660. Since 2018, the company's 2 founders have donated nearly $8,000. Shortly after Doug Ford praised Shouldes Hospital, a for-profit hospital in Thornhill, Shouldes' director of operations donated $1,000 to the PCs for the first time. Beyond their donation, they have been lobbying the government since 2022 to expand their role in the province's healthcare. Walter Schroeder is looking to build a $350 million surgical center in Richmond Hill. He has donated over $10,000 to the PCs since 2018. The list goes on of cardiology centers, MRI testing facilities, eye surgical clinics, and other private clinics that started donating around 2022 or a bit earlier. Although the amounts are relatively small, it raises questions about whether or not these donations are helping to secure meetings or contracts. Christine Elliott, who was Doug Ford's health minister from 2018 to 2022, became a registered lobbyist after leaving that position for a hospital known as Don Mills Surgical Unit, owned by ClearPoint Health Network. While Elliott was health minister, Don Mills Surgical Unit was expanded from 3 operating rooms to a 20-bed inpatient unit with 6 operating rooms and 7 recovery bays. At the time, this was also illegal under Ontario's Private Hospitals Act, which forbade the expansion of for-profit hospitals. During Elliott's tenure as health minister, the clinic received a funding increase of 278%. Throughout the pandemic, several former Ford staffers were hired by various telehealth organizations to lobby the government. During COVID, Shoppers was chosen by the province to provide COVID testing. The Minister of Health's Director of Pandemic Response was a former Shoppers lobbyist. The list goes on. Whether it be telehealth, pandemic response, surgeries, testing and lab services, you'll find a private company with a lobbyist connected to the Ford government receiving a contract. The stakes here are significant. They are literally life and death. Creeping privatization in healthcare across Canada risks breaking up the universal healthcare that has become a key part of Canada's identity. A private system has no benefits except to corporate interests and the wealthy, creating an unequal system in which the richest can get healthcare quickly and the poor will go into debt or remain ill. Substantial corporate interests in Canada and the United States want to see this become a reality. Investors from the US have already started to make inroads into Ontario, looking to make profit off of Ontario taxpayers. It's not too late to reverse this, to fund public health care, appropriately staff hospitals, and reopen emergency departments. But Ontario risks teetering the other way, denying the evidence and instead increasing wait times, making healthcare more dangerous and unequal, and growing a for-profit industry that looks to dismantle public healthcare. Thanks for watching this video. If you like this sort of content, please like, comment, and subscribe. And as always, a special thanks to everyone over at Patreon. If you want to support independent Canadian content like this, you can do so over there. The link is in the description. Thanks.